Let's talk about the use of blood thinners while on hospice. This is a frequent conversation we have with people once they come on to hospice. I find that most people who are on blood thinners are quite attached to them. This makes sense because nobody really wants to have a stroke, especially if they've already had one. It is important to know that hospice has no authority to say whether you can or cannot be or continue blood thinners once on hospice. It is true that more often than not, hospice recommends blood thinners be stopped once they come onto hospice, which I will explain why and in more detail in this video. The important thing is that there is a conversation and lots of education around blood thinners at the end of life, and it is always the patient's and the family's choice. Each hospice functions a bit differently, but they all function under the same Medicare regulations. It is a fact that hospices often do not pay for blood thinners, even when it is associated with their hospice diagnosis. So, when does hospice support and pay for blood thinners medications? In general, if a patient has had a recent blood clot, say in their leg or their lung, hospice will provide for the blood thinner. Also, if a person has had a recent heart valve replacement, this is to help prevent new and reoccurring clots. Generally, acute or recent blood clotting issues, hospice covers blood thinners. When does hospice not cover blood thinners, and why? If a person is taking blood thinners for a long-standing atrial fibrillation, they are usually not covered by them. The reality is the percentage of the lowered risk of a clot causing a stroke is quite low, and the risk associated with blood thinners usually outweighs the benefits. And generally, hospice does not cover blood thinners for long-standing issues of stroke, clotting issues, and heart valve disease. Again, the risk and the side effects of blood thinners usually outweigh the benefits for a body that is slowing and coming toward its end of life. Why does hospice often recommend stopping blood thinners? When in hospice, when people come onto hospice, it is because they are weaker and more frail. They are at the end stage of their lives. This means that their body and all their organs are also weaker and have less tolerance for these powerful medications. When people get weaker as they decline, they start to have falls and accidents. Unfortunately, this is normal and even expected, even though we try to prevent this as much as possible. There's kind of a standing joke at my work. When a patient has a fall, we are asked by administration to do an unusual occurrence report, and my response is always the same: falls at end of life are not an unusual occurrence. These falls and accidents can result in both external and internal bleeding when on blood thinners. This can result in unwarranted discomfort and even dying earlier than they normally would have. Even without falls and accidents, there is risk of bleeding in the declining and frail body. We see this in the form of nosebleeds, blood in the urine and in the feces, and moderate to severe bruising. This too can lead to pain and discomfort and death. Having been a hospice nurse for over 30 years now, I do have a bias about blood thinners at the end of life, only because my experience has consistently shown the risk outweigh the benefits. In hospice, even with the bedbound patient, we see bruising from the side rails and covers. Just a small bump can cause bruising so badly it turns into a hematoma, which is a large blood-filled pocket in the tissue, which is very uncomfortable and painful. Saying that, first and foremost, I honor what patients and families want. It's my job to make sure they are fully informed and educated about all the medications they are taking at end of life, with the ultimate goal of being the best quality of life until they die. I hope this has helped clarify some of your questions about blood thinners and the end of life. Please visit our website, the Hospice Care Plan, to get a copy of our booklet guiding families how to care for the hospice patient at home. Our free YouTube site has a hospice care plan, has over 300 videos like this demonstrating care and symptom management for the hospice patient.